Yeah, and that's a really tricky one to answer, because actually lots of the initial symptoms of developing type 2 diabetes are very vague, and you may not even notice them. It's not really until you get quite far down the line that you can develop sort of quite noticeable symptoms with type 2 diabetes. And that's, I think, almost important, that lots of us might actually be very at risk, or if not almost diabetic now, without knowing it, because we haven't got any symptoms. When it starts to get to the point that you get symptoms, things you notice is you might feel more thirsty, you might go for a wee, especially a little bit more, weeing more frequently, especially at night time. You might notice that if you cut yourself, it's taking longer to heal than before. You might feel a bit, you could feel tired. You might notice you getting a lot of infections where normally, you didn't sort of suffer from that. So they're quite sort of insidious symptoms that you may sort of not notice. I guess the key thing to think about is, if you've got a raised waist circumference, if you've got raised weight, if you've got a family history of diabetes, they're where you think actually it might be worth getting checked, because it's better to get checked earlier, identify it, and make changes, than it is to get to the point where you're really developing symptoms, and you're starting to get ill health from it. Absolutely. So having a family history of type 2 diabetes is a risk factor. And yes, we do generally look for first degree relatives, so parents or siblings, really. So if you've got a strong history there in the family, then that does put you more at risk. Ethnicity also can have a risk. We know that Asians, African Caribbeans, and Black African ethnicities are also at a higher risk of type 2 diabetes. So there are a few sort of risk factors that you can identify yourself that might think it's worth getting checked.